Good afternoon. Thank you, Apollo Hospitals and Dr. Reddy, Chairman, Dr. Sangeeta Reddy, for having us here. What I'd like to do is to talk about briefly the work that we have done, and more importantly, the approach, and it'll give you a sense of how we are approaching the emergence of intelligent cortex in the next decade. And it's a very, very important thing for us to have that understanding, as these technologies are evolving in the context of the planet. The important thing is this partnership between Apollo and Microsoft started a couple of years back to really understand what we can do in the primary prevention using AI and cloud technologies. And what we have done is to pool data from multiple hospitals and centers of Apollo Hospital, reason over it in terms of health check data, and really come up with an AI CVD risk score system that basically allows us to predict what will happen to the cardiac risk of a patient in the next 5 to 7 years. And we have ran that system for over 200,000 patients in the past year or so, with a very high accuracy, about 84-85%. And what we are finding is that the standard Framingham score risk model is not faring as much in the random control trials that we have seen on Indian population. So this gives us confidence in terms of saying, this is our risk score for Indian population. And to make this standard risk score for Indian population worldwide, what else we can do? So in that context, now we are partnering with public institutions like AIIMS and KGMU to bring forth their science and understanding of, prospectively understanding of this cardiovascular disease risk, to see how we can actually improve on not just urban population, but rural populations as well. And then hopefully one day, this AI CVD will become the standard risk score for Indian population and will save lives. But one of the things that I wanted to do is to also start to see, this is a mega trend, and like to share certain principles through which we have actually approached this. The one principle that is very, very important is ethical AI. And in this case, as we approach these problem sets, it's very important to basically have a notion of ethics in terms of do not harm is more important than do good. And when you have that science, taking that principled approach and the optics, it becomes very important for our data scientists and the cloud teams to really hone in and make sure that we're doing the right thing. The second very important megatrend that we are seeing in terms of global consortiums or global collaborations happening over cloud. And this actually, what we're really seeing is that this is actually going to drive freedom of global collaborations on data sharing across populations, and it will even further grow the research and innovation across multiple diseases. And we are already seeing these global collaborations across eye care, cardiology, pathology, and many more, across multiple industries. What we are really seeing is this whole notion of how we can come together with shared purpose and shared values and can make a difference in the world. The third very important thing that we see in all of this is this principle of intelligent edge and digital feedback loops. There is a notion of saying, hey, can we take this AI just as a data science project? Or can we actually have global consortiums on cloud for just collaborating and doing research? But digital feedback loops actually take you to the next level. What it means is that you have actually done an API integrated into your health checkup programs to actually start to prospectively learn from what you can do and what you can learn from to improve. Because these self-learning systems have to evolve not just on today's accuracy, but tomorrow, how can we actually become better at not just the populations that you are seeing, but beyond that and so forth. So this third principle of digital feedback loops, we believe, is a very, very powerful system. And Apollo has actually taken a leadership role in bringing these AI-driven APIs into its digital feedback loops through annual health checkup programs, and really actually every day learning from what we can actually produce in terms of low risk, moderate risk, high risk for these patients and populations, and what we can learn from it and further improve. The final two things I want to talk about is one is this notion of this whole sustainability, where we want to build these systems not just for us today, but also for future generations. So how do we enable the notion of sustainable business models in terms of using of these systems, not just here, but at the last mile, and what we can do together to really make sure that these systems are not just for a particular population, but beyond it and for the world. And then the last thing I want to talk about is something very, very interesting and futuristic, but this is where I think the world is going to head to. As these consortiums starts to happen worldwide, one of the very interesting things that we are starting to see, whether it is United States, Europe, Asia, we will see the inter-API consortium partnerships. So I'll give you an example. For example, if you have eye care consortiums looking at retinal imaging and understanding retinal conditions, how can you bring that best understanding of those consortiums into the cardiology consortium to predict stroke or heart failures using what you can learn from eye and what you can learn from cardiovascular disease markers and conditions and so forth. I think these are very early days for that, but still I think this is going to change the ecosystem and the economic paradigm of how the notion of health insights are going to evolve in the next decade or so. So thank you very much, and we are very pleased to have this Apollo partnership, Apollo Cardiology Consortium growing, making tremendous progress in terms of not just in India but globally, how the level of interest that we are getting